Congenital prosopagnosia is a deficient in face processing that is present from childhood when the individual does not have any brain injury and their sensory and intellectual functions are intact. They have trouble recognizing faces, including their own. Normally, a person looks at another person's eyes to recognize their face, but an individual with congenital prosopagnosia focuses on external features of the face, such as the mouth and the nose, and typically neglects the eyes. Past eye movement studies have had problems with the studies, such as tasks for congenital prosopagnosia and control child were different, so the children could not be directly compared to one another. There was a central fixation point on screen before the trial, which brought the gaze to the middle of the face, and this could bias the exploration pattern. And stimuli were exposed too long, resulting in unnecessary eye movement for performing facial recognition. Past studies have also used celebrity pictures for recognizable faces instead of the patient's own family members. In fact, congenital prosopagnosia studies are rare because of the difficulty in finding stimulus materials. The present study wanted to characterize the EM patterns of two family members with congenital prosopagnosia. They were LG, a 6-year-old boy, and RG, his 38-year-old father. LG was concerned with recognizing familiar faces and produced false recognition of unfamiliar ones. His neuropsychological assessment showed normal development with selective failure of verbal memory and memory for faces. He was diagnosed with congenital prosopagnosia when he had no injuries to his brain or any neurological and psychiatric disorders. RG had problems recognizing colleagues outside of the workplace or friends he had not seen in a long time. Their friends also noticed how he never looked them in the eye. His IQ was above normal range, and he showed no deficient in object and space perception on the visual object and space perception test. He scored within the normal range for recognizing emotions and unfamiliar faces. However, he was still diagnosed with a less severe case of congenital prosopagnosia. In addition to RG and LG, two controls were also recruited, a 39-year-old man and a 6-year-old boy, who were matched for social class and years of education as the control participants. Eye movements from the dominant eye and vocal responses were recorded via an iLink 1000 eye tracker. A headrest was used to avoid head movements, but the chin was free for vocal responses. To make the next face appear, participants would look at a cross steadily outside of the viewing area, and then the face would be displayed to avoid unnecessary eye movements. Each picture stayed on the screen until a vocal response was made, and the order of the faces were randomized. And there were two identification tasks, one that was naming of cropped faces and one that was naming of complete faces. For the naming of complete faces, 6 pictures of RG or LG's self and family faces were used for the patient's personally familiar stimuli. 6 pictures of strangers that matched with age and sex of family members were used for unfamiliar stimuli. The same setup was used for the control child and the man, but with their own selves and family member pictures. For the cropped faces, the same number of pictures were used with the same people, but they were all wearing headbands and the pictures were cropped in a vertical ellipse, so the participants only saw half of their face. There were also 2 discrimination tasks that consisted of gender decisions and age decisions. These were 24 black and white pictures from the Rivermead Behavioral Memory Test that were used for these tasks, and 12 were for the gender decision and 12 for the age decision. Participants had to respond male or female in the gender decision, and young or old in the age decision task. The eye movement data were processed using iLink data viewer software, and the audio recordings were processed offline using Audacity software to measure accuracy and response latency. This allowed them to include eye movements associated with face decoding until the vocal response, and to exclude the eye movements belonging to extra recognition processes. The number of fixations up to the vocal response and the single fixation durations were included in the eye movement parameters, and these parameters were computed separately for 3 interest areas: the eyes, the nose, and the mouth. The first fixation position was also measured for each trial to determine the frequency with which the eyes, nose, or mouth were fixated first. And t-tests, or Fisher's exact tests, were run to compare each patient with the respective control. Patients were accurate in the discrimination tasks and only made mistakes in the identification tasks. LG had significant inaccuracy with both cropped and complete faces, and his father, RG, only had inaccuracy with the cropped faces, but the difference with the controls was not significant. For vocal response latency, overall, patients were significantly slower with the cropped faces than with the complete faces. LG was slower in both identification tasks, and RG was only slower in the cropped faces identification task. For the number of fixations until the response, participants responded to each task by making about 2 or 3 fixations, no significance difference between patients and controls. For single fixation duration, the patients showed longer fixation durations across all tasks than the controls did, which shows that they overall had difficulty recognizing faces. For the spatial distribution of fixations, or the amount of looks that landed on the eyes, the nose, and the mouth, both patients had fewer fixations on the eyes and more on the mouth than the controls did. RG made more than 2.5 times fewer fixations on the eyes than the controls did across all tasks. LG neglected the eyes in the identification tasks only, showing more than 2.5 times fewer fixations on the eyes than did the controls. Both controls looked at the eyes more across all tasks. For the first fixation position, or the number of trials in which either the eyes or nose or mouth were looked at first, LG only looked at the eyes first when deciding age or gender. RG rarely looked at the eyes first across all tasks. The controls looked at the eyes first in almost every trial. For spatial distribution of fixations weighted by fixation duration, or the amount of time looking at the eyes, nose, and mouth, both patients spent significantly less time looking at the eyes and devoted more time to the mouth in the identification tasks than did the controls. LG performed similarly to that of the control child in the discrimination tasks, but RG gave little attention to the eyes in the discrimination tasks. This was the first report done that examined the eye movement pattern of 2 family members, and one being a child is rare. Pictures were based on personally familiar faces and not those of celebrities, and vocal responses of who the person was were made instead of just pushing a button for recognition. Verbal responses involved lexical access associated with the identification process. The discrimination tasks allowed for examining the eye movement patterns of unfamiliar faces. The first fixation was looked at, which has not been done in previous congenital prosopagnosia studies. Both patients were inaccurate and slow in identifying cropped faces, and LG had problems identifying complete faces as well. Both patients completed discrimination tasks quickly and accurately. In all tasks, the same number of fixations were present in both patients and controls, which shows that there were only few fixations on the face that are needed to identify a face. Both patients neglected eyes and focused on the mouth more in identification tasks. The duration of fixations were longer in the congenital prosopagnosia patients in all tasks compared to the controls. For the first fixation point, patients rarely looked at the eyes first and looked at the tip of the nose first more often than the controls did. RG did not look at the eyes throughout the trials, but LG only neglected the eyes in the identification tasks. To process faces in general, they did not need more fixations, but more robust temporal sampling. This suggests that congenital prosopagnosia research should contribute to the development of protocols that combine more ecological procedures by using verbal responses along with the visuo-perceptual manipulation of stimuli. One limitation of this study was that there were only 2 controls.